the world, promoting their professional, cultural, and social interests. We strive to help them realize their maximum potential in the service of global peace, prosperity, happiness, and compassion. Additionally, we provide a platform for networking and sharing relevant and timely information that concerns the Indian PIO community. Today, GOPIO Singapore boasts a membership of over 200 individuals and plays an integral role in Singapore by connecting various Indian organizations and communities. Beyond hosting our own initiatives, we collaborate with key organizations such as Indian High Commission in Singapore, SICKI, HEB, LISHA, and SINDA to organize joint events. Here are some of the notable events we have hosted. First, hosting Indian ministerial visits, including dignitaries like Prime Minister Narendra Modi, Mr. Muralidharan, the late Sushma Swaraj, Venkaiah Naidu, and many more. Second, business seminars, both locally and internationally. 3, cultural activities, showcasing the richness of our heritage. 4, quarterly business and medical talks like the one we are attending today. 5th, youth activities and camps conducted in Singapore and Malaysia. And lastly, to name is GOPIO Junior Star, empowering our young talents. Sorry. For today's event, our focus is on the community's well-being. We are here to talk about something that beats tirelessly for us every second of our lives, our heart. In a fast-paced world filled with distractions, it's easy to overlook this vital organ that powers us through every moment. Today, we'll explore how to take charge of our heart health and make choices that keep it strong and thriving. From understanding the risks of heart disease to practical tips on diet, exercise, and stress management, this session is designed to empower you with knowledge and tools for a healthier, longer life. Let's dive into the journey of nurturing a healthy heart, because your heart deserves the care you give to others. At this juncture, I would like to express my heartfelt gratitude to Dr. Jayaram for taking the time to deliver this valuable talk, and to all of you for joining us and spending your Sunday evening with us. Without further ado, I would now like to hand it back to our MC, Mr. Muthukumar, who will provide a more detailed introduction of our speaker. Thank you.
Thank you, Mr. Akbar Ali. Thank you for your warm and insightful welcome. In fact, you have set the perfect tone for today's program, and which made my job easier for breaking the ice. Let us give a round of applause to Mr. Akbar Ali.
Thanks.
Thank you. Let us go to our next heartbeat. It is now my pleasure to call upon Mr. Tam Shanmugam, a member of a Management Executive Committee of GOPIO, to introduce our medical talk speaker for today's session, Dr. Jayaram Lingamanaicker. Over to you, Tam.
Yeah, thank you, Muthukumar. Thanks for that. So Dr. Jayaram Lingamanaicker is one of the leading cardiologists who have vast experience and expertise in performing balloon angioplasty and stenting for many years. He has more than 20 years of experience in clinical medicine and cardiology. He has his education and training in various prestigious hospitals in the United Kingdom, including Oxford. He took his basic degree from Edinburgh and continued his career over 12 years at various hospitals in UK. The excellent and pioneering teachers at the time had molded him to be a fine cardiologist. He's a very well versed in cardiac catheterization and stenting, echocardiography, pacemaker implantation, and many of the latest cardiac tests. He has a great passion for treating cardiac problems. He has the following qualifications to his credit, such as LRCP, LRCS, LRCP and yes, Glasgow, MRCP in UK, member of Royal College of Physicians, and then FRCP, Fellow of Royal College of Physicians, Fellow of American College of Angioplasty, FACA in USA, Fellow of Academy of Medicine Singapore, FAMS Cardiology, FACC USA, Fellow of American College of Cardiology. After completion of his studies and training, he returned to Singapore as consultant interventional cardiologist based at Changi General Hospital, a large 850-bedded government hospital, where he later became senior consultant head of the division of cardiology. He has done extensive research work and published widely and twice won the Best Teacher Award. He was conferred the BPM by the President of Singapore and was also awarded the Best Medical NRI Doctor by the Chief Minister of Tamil Nadu. And that happens last year, right, Doctor?
Yeah.
That was last year. So he teaches at the National University of Singapore in the capacity of senior lecturer, also attends a lot of cardiology conferences and has been invited guest and speaker in the Asia Pacific region. After 10 years in government service, Dr. Jayaram has his own practice at Farrer Park Hospital and Mount Elizabeth Hospital in Singapore. All these are his academic qualification and his professional excellence. And he also done a lot of community activities, which I would like to highlight one of them. He was part of Hindu Endowment Board as a member, and he is also a chairman of medical committee there. And he is a key person behind running a large-scale health fair jointly by Hindu Endowment Board and MediaCorp together. So this year we signed an agreement, memorandum of understanding with MediaCorp, and Doctor is the key person who's running this with the help of his colleagues and nurses and others. So that's the introduction about this, Doctor. Thank you, Doctor, for kindly agreeing to be the speaker for today. Thank you. Thank you. Over to Mr. Muthu.
Oh, thank you, Mr. Tam. I imagine the amount of deep breath, you would have practiced to introduce Dr. with such a huge list of academic, professional, and community accolades. Let us give a huge round of applause for Mr. Tam for starting us off with so much energy and enthusiasm and details. Thank you, Tam. Before I invite the speaker, I'm going to share you the, in the Zoom chat for you to raise question, a link on Pigeonhole for our upcoming Q&A sessions. Post talk session, we'll be having a Q&A sessions. So I'm just giving you a link upfront. The reason began is, so when Doctor takes the session, right, and probably you can just you can raise your questions there. Towards the end of the session, we'll probably have a Q&A to go through, a few key questions on that. The time permits for all. Thank you. Hope you got the link in the chat box. Now, so let's get to the deep dive into the details. So sit back, enjoy the program. And if things gets too exciting, don't forget to breathe. Let's keep those heartbeats steady and spirits high, BP down as we kick off an unforgettable evening. Ladies and gentlemen, please join me in welcoming our Dr. Jayaram Lingamanaicker for the medical talk on healthy heart and you to share his expertise and invaluable insights and guide us in taking better heart of our hearts. Doctor, the virtual floor is yours for the webinar. Welcome, Doctor.
Thank you. Thank you, GOPIO, and all the members who had been kind enough to welcome me. And thank you for the generous introduction by Tam. So without any delay, I will go ahead with my slides. Okay. So how common is the heart disease? As you had earlier mentioned, it is 1/3 of all the deaths worldwide, including Singapore, is cardiovascular death. So it's 1 in 3 people die of heart disease or heart-related disease. And total about 17 million people die worldwide from cardiovascular disease. So it's not a very small condition. It's a huge medical problem throughout the world, including Singapore. So we can see on the right side, 50% is coronary artery disease, and the rest is like a stroke, high blood pressure, congestive heart failure, rheumatic fevers, and congenital heart disease, like the hole in the heart. Other things contribute a small amount. But on the whole, if you on the more than 50% of coronary artery disease, which means a blockage of the arteries. There are 3 main arteries supplying the heart. One is the left coronary artery, which has 2 branches, the circumflex and LAD, and the right coronary artery. These 3 arteries supply the heart, which weighs about 350 grams. So how do you know that somebody has a heart problem? When there is some narrowing of the arteries of the heart, one of the three arteries, maybe 70 to 80% narrowing, then what you will get chest pain. This chest pain in medical terms is called as angina. Angina is a condition where you get chest pain on exertion after a heavy meal, or walking or running or going up slope or climbing stairs, lifting heavy objects. But this pain usually on the left side, which will go away with rest. So here the arteries are not totally blocked. It is 70-80% blocked, compromising the blood supply to the heart when you do the above exertion, going upstairs, all this. So this will bring on the pain. So pain is a early warning system or a red flag to anybody who experience this, to go to the doctor to have it checked early to make sure that it's not the heart. So where is the pain? The pain usually classically is on the left side, which is radiating to the left arm. So when you climb up the stairs, you get this pain on the left side, go down the arm. You stop, the pain goes away. When you start again, it recurs. So it can be on the right side, right arm as well. It can go to the jaw. Some people have gone to the dentist for this reason, and then they found out they have a heart problem rather than a dental problem. It can be in the epigastrium. People think they have digestive problems. They drink soda and things to clear up, but it is also part of a myocardial ischemic heart disease. It can be in between the shoulder blades, like a knife sticking to you when you're climbing and doing all these things. So these are all these warning symptoms that you may have narrowing of the arteries of the heart. So when the arteries, which we said before, is a 70 to 80%, you get chest pain and call as angina. But if those arteries completely block off, then only we call this as heart attack. And it's a classical ECG changes will take place. Patients will become very ill, and the chest pain will be severe. Usually it doesn't go away. It stays there for a long time, more than 20 minutes. Profuse sweating, shortness of breath, nausea, vomiting, sometimes dizziness, even fainting spells, because the major artery closes, the heart cannot pump properly. Therefore, the blood doesn't go to the brain and you feel really dizzy, and some people even faint. So these are classical signs of a heart attack which has happened, which means 100% closed artery, and you need to seek emergency medical attention. So let's see who are these people who can get heart disease. So most of us think that we are all healthy, but what's inside we do not know. So we are considering certain things called as risk factors. Risk factors are modifiable, means which these factors can be been avoided or even treated. So for example, number one will be smoking. Smoking is one of the risk factors for building up of the the cholesterol in the arteries. Diabetes is a very important cause. High blood pressure, high cholesterol, overweight, lack of exercise, stress. All is the more the number of these you have, the more chance that there may be blockage in the arteries. Just one or two maybe not be the reason, but it adds up. Weightage goes on as you add the risk factors. There are non-modifiable factors, which are family history. We had one patient last year. There were 7 in the family, 11 in the family, 7 boys and 4 girls. Big family from India. And all the first 4 people had bypass surgery before 40. And the next 3, it had angioplasty and stenting. The last 7th person, I did the angioplasty. So 7 people complete out. All of them had heart disease. And this is family premature, which means 45 and below the age. And for women, before menopause. If they get heart attack before menopause, it's included in the family history. And for men below 50 years, if you have a heart problem, then it is included in the family history. So age 40 plus is a risk factor for heart disease, and male gender itself is a risk factor. So when you have a heart attack, it means when the heart is completely blocked, and then the previous symptoms, you have to call for an ambulance 995 in Singapore immediately. While waiting for the ambulance, you can take 1 or 2 aspirin tablets if you have, or any neighbor or somebody has, because aspirin is an antiplatelet agent. This will immediately take effect, and it will make the blood thinner so that the clot which is blocking the artery may disappear, may not be disappear, but it will make it not worse until you go to the hospital. It is almost certain that you should travel by ambulance, as it decreases oxygen. They have an AED, they have IV sets, they have adrenaline. All the staff are, the paramedics are trained for this, and they can communicate with the receiving hospital that they are bringing in a heart attack patient. So the receiving hospital and A&E will be ready to receive them. Normally in Singapore, anyone who has a heart attack, by 90 minutes, patient artery is open and a stent is inserted. We normally, when I was in Changi, our time was one of the best, less than 90 minutes to have the artery opened. So that's because after 4 hours, if you open the artery, the damage done to the heart is more or less permanent. So the ejection fraction, which is very important, which means if you put 100 ml into the heart contracts, pushes 60 ml out. So this is called as ejection fraction. That is EF is 60%, which is normal. So that can drop to 40, 45, 30%. If it goes below 35, even walking about 10 meters, 20 meters, you'll become very breathless. You won't be able to. So the heart muscle is a very, very valuable muscle, should be what you call safeguarded within the first 4 hours. So next is smoking. As we saw the risk factors, this is quite easy to give up if you have the willpower. So what happens is 2 things happen. One is the carbon monoxide, which is and the nicotine, which is mixed in the blood, increases atherosclerosis. Atherosclerosis means deposition of cholesterol inside the arteries. The diameter of the coronary artery is not very big. It's 2.5 to 3 millimeter, very small pipe. Lesser than the straw which we suck with the straw, that is the size. So if you have a small thing inside, it will block 50% can be blocked very easily. So the carbon monoxide and the nicotine in the blood increases the deposition rate of these arteries. Normally, it will not take overnight. It takes usually about 8 to 10 years to completely destroy the arteries. So the nicotine clots the blood easily. So when you have a 90% blockage, and 99%, sometimes some people have a 99% blockage of the arteries, the nicotine in the blood will clot. Small platelets can clot and block the artery, producing a heart attack. So most of the smokers' heart rate is always higher. And the carbon monoxide, which is in the smokers, which goes into the lung, has got a great affinity for oxygen. The oxygen, which is for hemoglobin, oxygen, which is we breathe into the lungs, and the carbon monoxide, which also goes into the lung, they compete with each other for the hemoglobin. The ratio is 500:1. So instantly the carbon monoxide attaches to the hemoglobin, produces carboxyhemoglobin, which means there is no oxygen being transferred to only the carbon monoxide is transferred to the tissues. So very important to stop smoking. So this is a normal lung which floats on water, is a pinkish color. And this lung, if very chronic smokers, becomes like this with emphysema. All the black thing you see is the tar which you see on the road, exactly the same tar. And then the one which is which we see here, these are all the bulbs. These are small air sacs which has ballooned up like this. So many ballooned up air sacs suddenly can burst, collapsing the lung, which is also a medical emergency. So emphysema, bronchitis, carcinoma of the lung, coronary artery disease are all directly related to smoking. So you have to stop smoking. So this one I showed so many meetings. The people, I'll ask them what is the brand of the cigarettes which is being used. Almost all of them say it's Benson Hedges. So such is the power of advertising by the companies. So as I said before, 5:1. For 5 male, there's 1 female. That's before the premenopause. After menopause, the women and men are the same. So Family history, if one parent is affected, it means father or mother below that age, then there is a twofold risk in the children. If both the parents are affected, there is a fivefold increase. So anyone who has got a family history, even if you don't have any symptoms, it's better to have your heart checked, make sure there is no blockage or narrowing of the arteries. Nowadays, we have CT angiograms, which will clearly show if there's any narrowing. If there is narrowing, then we can aggressively treat so that it doesn't progress to heart attack. So diabetes is one of the worst disease. It affects all organs in the body, and heart is not an exception. The blood vessel which is going to the heart or going down the lower limbs or any part becomes narrowed. The lumen, the yellow line, and this is where the blood flows. It has to be there. So it becomes short, it becomes thickened, and then the blood flow is very, very compromised, which leads to heart attack in men, which is the risk is double in men. And if you are a woman, it's worse, it's quadruples the risk of heart attack in women. So the circulation to the foot also can be, foot or the lower limbs usually are compromised with very bad diabetic control, where they can produce gangrene of the toe and eventually have to be. And also the eyes. The commonest cause of blindness in the Western country is diabetic retinopathy, where all these yellow color is all the X-ray, which means there is outflow from the blood vessels. These small spots are bleeds. If the bleed is in this black area, here you can see a big bleed there. If that has happened here, the vision is permanently blind. So diabetic people have to be very, very careful, and then they should keep the hemoglobin H1C less than 7% all the time. Hypertension is silent killer, which means hypertension, public think that hypertension means you can get headache, dizzy spells, but not really. Hypertension is a symptomless. So hence it's called a silent killer. You can have 200 systolic pressure and be shopping around without any problem. So unless you go and measure, you will not find whether you got high blood pressure or not. So hypertension triples the risks of heart disease in men and doubles the risk in women. So it's a very important etiological cause, which can be easily treated. Just one tablet a day can bring down the blood pressure, and you can avoid coronary artery disease. Normal blood pressure 130 by 80, 135/85 is pre-hypertension. If you have 135/85, maybe once in a few months you need to check, make sure that your blood pressure don't go up. Something like pre-diabetes. What happens if you have high blood pressure untreated? The heart is pumping against high pressure, and it's like taking the dumbbells. The muscles become thickened, and this one should have been here, come down all the way. This is the cavity of the heart. So it's just a big chunk of muscle where the volume of the blood is very less. So the patient becomes very breathless, cannot walk. We call hypertensive cardiomyopathy, and leads to severe heart failure. And also it can lead to bleed. So actually when they say bleeding for a stroke, only 10%, 5 to 10% of all strokes worldwide is due to bleed. But mostly it's due to atheromatous clot going to the brain. And that is by the, as we said, thickening of the arteries in the neck in diabetic patients and hypertensive patients. And small plaques get displaced, it goes to the brain, producing a stroke. So stroke is one of the, hypertension causes a stroke as well. Now coming to the cholesterol part, we have divided into primary and secondary. Primary is normal people, general public, where this is the bad cholesterol, LDC should be less than 130 in most young people. But if you reach middle age, we would suggest that to be 100. HDL is the good cholesterol, it should be more than 40 in both group. 40, the only way to increase the HDL cholesterol is by regular exercise. There is no drug to increase there is drug to reduce the LDL, but there's no drug to increase the HDL. The HDL is only by exercise. Total cholesterol to HDL ratio is very important. If you have 4.5 is normal, but 3.5 and below is a low risk for coronary artery disease. On the right column here, we see secondary means you had a heart attack, or you had a stent put in, or you had a bypass surgery done earlier, or they did an angiogram and found that you had 30-40% block. Now, your cholesterol LDL should be 70 or less, and the ratio should be 3.5. So this was very important. The triglyceride, both cases should be less than 150. To avoid, going back, the cholesterol, 80% of the cholesterol which we see in our blood is from our liver. Liver is the one producing the thing, and 20% is from what we eat. So the majority of the cholesterol is from the liver. Hence, statins like rosuvastatin, atorvastatin is given to reduce. But also there is a 20% of the what we eat also contributes to the cholesterol. Hence, avoid all the high fat foods like what I've seen in the picture there. Fruits and vegetables are very good because not only for the vitamins and things, they are high fiber diet. High fiber diet stops the absorption of cholesterol from the intestine, therefore reducing the cholesterol. At 20%, I said this is a good way of reducing. Weight and obesity worldwide, obesity has increased because the lifestyle of people have increased. If you look at countries like India, where huge development is going on, a lot of people are becoming obese, less and less beggars. So everyone has food to eat. So and nowadays you order as our MC said earlier, you can order pizza, you can order so many things from different outlets. So don't need to cook. Easy way of eating, and that's a very important cause for not only diabetes, high blood pressure, heart disease, and commonly see how that man's knee joint surely will go in a few years. It cannot bear that weight. Osteoarthritis is a common cause of the overweight. So stroke increase of high HD, abdominal obesity. If you go to executive checks, they'll measure the abdominal obesity. If it is more than the required for that age and height, it doubles the risk of ischemic heart disease. Exercise increase, lack of exercise increases heart disease by 2.5% or 2.5 times. So exercise is very important, but I don't 25 minutes a day, 5 days a week is a must for most for the well-being, not only for prevention of heart disease, but for other conditions like joints and things, diabetes, high blood pressure. It helps in most of the conditions. In hyperlipidemia, cholesterol, if you can see, this is a normal cholesterol thing in the artery. As we go slowly over the years, it builds up slowly. And then this is the narrow, here the blood flows 89. So this is called as atheroma, atheromatous plaque. This is almost every patient who dies of heart attack has got this. So this one is coming from HDL, because a lot of people nowadays say that don't need to treat cholesterol. Cholesterol is God-given, just be left alone. But I think evidence-based medicine suggests that this contains a lot of LDL, and then it has been proved. So every heart attack is a condition like this, atherosclerotic heart disease. So cholesterol has to be treated properly. Not everyone should be treated. The age is important, then the level is important, then you have to decide. So when you open up an artery, it looks like this, very healthy artery, but with a very high cholesterol patient, like 300, 400 levels, it becomes like, you can usually scrape this like a grease from the surface of the artery. So these arteries are all cholesterol-laden arteries. So cholesterol has to be eaten. When you look at the heart, it's only, as I said, 350 to 400 grams, and it's a muscular pump, which is a nice rosy pink color. And this is the ventricle which pumps. This is the thickness of the muscle, about 1 centimeter thickness. So you cannot endanger the muscles by blockage of the arteries. So here you see on the surface inside they cut open one of the arteries. You can see the blood has clotted, and then this area beyond that blockage, the heart muscle will die permanently, because this heart and the brain tissue does not regenerate. Liver, you cut a portion of the liver, liver will grow back, but heart and the brain will not. That's why it's so important to treat them early. After a heart attack, if you look, this is a postmortem thing. If you look at the heart from outside, it'll be like a bruised, all this huge area gone. This whole front part of the heart has been dead by blockage of the LAD artery, probably. Sometimes you notice that people after a few days in hospital suddenly collapse and die. Can be due to rhythm disturbance, or sometimes there is an area of heart attack here. At the tip of the heart is usually a bit thin in nature. It can perforate, and the entire blood contents will leak into the body, into the thoracic part, and the patient, very difficult to resuscitate these patients. They always die. So what are the treatment for heart attack? There are lots of treatment now improving slowly. And the first early part, we didn't have anything, just bed rest and keep them on. Now, then in the 1990s came the crossbusters, streptokinase, RTPA. These are injections given to the patient with a heart attack. The clot dissolves in the heart, and then the circulation is restored. So after restoration of circulation, but still that atherosclerotic plaque, which is 80% block, will remain, and that will be later they do an angioplasty and stenting. This one, angioplastic catheterization, is the one I was talking about. Immediately after a heart attack, your ambulance takes you to the nearest hospital, where they take you to the cath lab, and then they do the angioplasty and stenting within 90 minutes. Then if the patient has multiple blockages, which is not amenable to stent treatment, we send them to bypass surgery. But bypass surgery is coming lesser nowadays because so many arteries can be stented. Here you can see the total occlusion of the right coronary. Right coronary artery is a single artery. It's something like a C-shaped artery. So that's blocked here. See, this is the catheter injecting, nothing is going. So then the next one is you pass the wire as an emergency. Wire passes through. Once the wire passes through, we know blocks may be here. So we use a balloon there to open up that part where it's blocked, and then stent the area where you think it's very tight. Then the artery is restored. So once this is restored, all this principle you can see here, all this area which was temporarily non-functional, it become functional after opening the arteries. And they survive within 4 hours. If you've done that, it survives successfully opening the artery. A stent is not a very big thing. It's a very small, you can blow off. It is that's a thumb. That's a size of 2.5 to 3.5 millimeters, 10 to 18 to 32. We have longer stents nowadays to cover several lesions. So these are all small. And once you put the stent inside the artery, through these holes, the tissue grows, and like a cementing the pipe, it will become smooth. After 6 months to 1 year, if you imagine, if you put your finger and feel for the metal, you will not feel the metal. It will be smooth. It will be like a plastered tissue is formed. And therefore, that stent remains there permanent. It doesn't move. For many, many years, it can be there. You can get narrowing in other parts, where not at the part where you had the stent put in the first place. Here you can see an angiogram of a LAD, which is there, the tight spot there. And then it was stented. After stenting, 4 months later, an angiogram shows it's still patent, opening fully. And then 1 year later, so after 1 year, mostly it is permanently like that. You can get disease there, somewhere else, not in this place. Very rare to get, only about less than 3%. So when they say cardiac arrest, what is cardiac arrest? As we say before, when the artery is completely blocked, you get a heart attack. When you get a heart attack, 45%, imagine half the people, 45% die within the first hour before reaching the hospital. That's why ambulance is so important to bring these patients to the hospital. Sudden stoppage of beating of the heart, patient lost consciousness, no pulse, no breathing. So if outside the hospital, you have to do CPR and mouth-to-mouth respiration. until the ambulance arrives. When the ambulance arrives, they have the ambu bag. They can intubate the patient. They will give injection adrenaline, and the AED, which we see in most of the shopping centers, all is fixed automatically. It will find the rhythm and shock and bring the patient to life. But this one outside hospital, cardiac arrest is very difficult. As we see here, only 2.7% survive. Most of them die outside hospital. I do not know whether you saw the was circulating in the social media of Singapore Shivaji collapsing and while he was singing, and everyone was shouting. I was looking for the continuation of the video, but they stopped. I think if it's a hall, I don't know, some hall, I don't know where he was doing, but if somebody had done a CPR with the AED, there's a high chance that he would have survived. Just screaming around and shouting and panicking does not help. So in Seattle, for many years back, they took a thing in Sweden, up to 40% success. So public from high school, they teach them how to do CPR. So it's a part of the curriculum. So they are very good at it. So to prevent heart disease, the American Heart Association recommends people's blood pressure should be checked. And from the age of 20, you look at the body mass index, overweight has a big thing. Weight circumference is mainly for the Americans, very big people. Cholesterol, fasting glucose. This one easy to find, easy to 1, 2, 3. All the 3 very important risk factors can be found out if you can have it checked. We have, my youngest patient we have is about 28 who had 2 stents put in. In the 30s, there are a lot of patients in 30s, 37, 38 with angioplasty and stenting. Of course, 40, many people. It takes 10 years for the cholesterol to deposit in the arteries and to bring the blockage. So 20 years fellow starts here. When he's 30, he will have 70 to 80% blockage if his cholesterol is high. So this fasting glucose also important for diabetes, but cholesterol, high blood pressure, these 3 things has to be checked every 2 years. So when a patient has a heart attack or anything, then you have to educate such patients about symptoms. Normally, if you get chest pain, let's say you get jaw pain after a heart, then you take to the hospital and they put a stent, everything, and you go back. When you get another heart attack, it'll always be the jaw again. It will not go anywhere else. So the pain is repeated for the same size. So that's why we have to educate the patient. Say, if you get the symptom exactly like before, means it's a heart. So most of the people will ask, is the symptom similar to the one you had heart attack? No, sir, it is different. That means we dismiss them. And then the use of GTN. Some people use it, they don't use it. They keep on keeping it. So whenever you get chest pain, you must use it. GTN use is in the education we tell, because if you use a spray or the GTN tablet on the tongue, within 60 seconds, within 1 minute, the chest pain should disappear. Only then it's a heart. After 5 minutes, it disappears. It's not heart. It can be muscular pain. So antiplatelet agents, there are 3 now: aspirin, clopidogrel, and Brilinta. They'll give any 2 of this for 1 year for with somebody with a stent. So you must, even if you don't take a breakfast, you must take these 2 if you have a stent. And after 1 year, one of them will be stopped. Just aspirin for life and cholesterol medicine for life will be the thing. LDL for heart attack patients should be really low, around 55. So only when you see in our hospitals, Lipitor or atorvastatin, the dosage they give you is 40 milligram tablet, 80 milligram tablets. But generally we give 10 to 20. But during that period, we have to give very high dose so that to bring it down as low as possible. So preparation for discharge. If you're in the hospital or if you're even outpatient, your BP should be less than 135/85. Diabetes should be less than 7 HbA. This is the 3 months HbA1c average. And smoking, you cannot reduce. Really, you wanted to good for yourself, you must stop smoking. Let's say there are a lot of people say I can't stop smoking. And I had one patient who can smoke 2 packets a day. He used to smoke 2 packets, 40 cigarettes a day, continuously smoking. And then I think something, he got into trouble. They put him 6 months in Changi prison. In Changi prison, they don't give 40 cigarettes. So that fellow went for 6 months without smoking. And then when he came, I asked him, how do you manage this? First, he used to tell me, I cannot stop, sir. You can stop if you have the will. Medication is very important. There's a long list of medication. I've written everything. More aspirin, statins, and all these things for the heart and for high blood pressure medicine. All has to be taken, especially if their heart ejection fraction is 40%, which means normally 60 and plus. If your heart is being damaged by heart attack, they give something like Entresto, AIC inhibitors, all these drugs, very important to help the heart so that you don't go into heart failure. So all this should be taken, and I wish everyone follow all the precautions to prevent heart disease and stay healthy. Thank you.
Thank you very much, Dr. Jayaram Lingamanaicker, sir. Wow, what an incredible session. Huge thank you to you, Doctor, for
Thank
the
you.
true eye-opening talk.
Yeah.
Not only did you give us the heart of the matter, but you also give us a lot to think about when it comes to protect your most vital organ. But seriously, your expertise and passion are quite evident, and we are incredibly lucky to have you here. You have truly given us the tools to take off your hearts, both figuratively and literally. And maybe some of us will start walking a little more after this session.
Yes, sure.
I take this opportunity to thank you on behalf of GOPIO and participants who are captivated by your talk, which reminds me, healthy habits today lead to healthy heart tomorrow.
Yeah.
So let's all give a doctor a big round of applause.
Thank you. Thank you very much.
Thank you all. Now, next session. Dear audience, now it's your turn on the questions. We will now have a short Q&A sessions. Hope you have raised, I could see some of you raised questions in the given link. Poor, joined a bit late. I think I've just pinged the pigeonhole link to raise questions there. Some of you have raised it. Probably we can give a start. Let me open a Q&A panel for Doctor to clarify.
Yeah.
Let me share the questions, Doctor.
Okay. I press the chat one there.
No, let me, no. I can just read it for you. No issues.
Okay.
Probably you can stop your sharing, Doctor.
I stopped.
Okay, thank you. Hope it's visible. Okay. There's two people who have a question. Good evening, Doctor. How long can we exercise for being healthy? I've seen some videos where people collapsing while doing exercise in gym nowadays. Is it advisable to sleep face down? Thank you. Praise be Vengat.
Okay. The recommendation is about 25 minutes a day, 5 days a week exercise within your capacity. So young people are there are old people are there, depending on within your comfort zone, you must do. There are two ways to exercise. One is the cardio exercise, where you raise the heart rate. So you can go on a small treadmill if you have at home, or you can go brisk walking. If you're younger, you can jog and walk, make your heart go faster. That's one thing. Then just for the build-up of the muscle, you can just take some dumbbells and things. Those are things which are recommended. Swimming is a good exercise. Cycling is a good exercise. All this within your capacity. So that's why, that's a time limit for the exercise part. As far as the people who collapse at gym, the condition is called as there is a condition called as a hypertrophic cardiomyopathy, which means the muscle of the heart is abnormal, but the patient don't know, and they just run and do, and the NBA players, football players collapse and die. So all these patients, very difficult to find out. These patients, solely we should always ask, is there any sudden death in the family? So when we do an echocardiogram, we can find out whether these people have abnormal heart muscle. If there's abnormal heart muscle, the heart muscle will trigger ventricular fibrillation, which means irregular heart rate, very fast heart rate, and then they collapse. So only now, if you look at football stadiums, swimming pool, everywhere they have the AED. So you shock them, they'll come back to life. If you don't, within a few minutes, they will not come back. So that's maybe the cause for the collapsing. Most common cause is the collapsing of that one. So because they collapse, it does not necessarily that we should not exercise. We should exercise. If once all your parameters are good, then you should exercise. Sleeping wise is very difficult to tell me. I think sleeping face down is not usually recommended. Normally on the sides are the ones. If you sleep facing up, a lot of people snore because the epiglottis goes down and then blocks. So it's like a sleep apnea. So and then you tend to open the mouth a bit, so you have dry mouth and tongue. So most of the people lie on the side. So whichever comfortable. See, everyone sleeps in a different posture, and whichever comfortable posture you should sleep. I think sleeping just I want to sleep. Sleeping by facing down is important, is good, and you cannot compel yourself and sleep like that. You just sleep normally, whichever way you feel sleep, you can sleep. There's no particular way, except looking upward, signing people will snore. That's all.
Thank you, doctor. I think now I know how to sleep to avoid snoring to get beat by my wife. Thank you. Okay, then let's go to the next question. Statins medications help lower total cholesterol and reduce the risk of heart attack or stroke. Should I worry about possible liver damage from taking statin medications?
Okay, very good question. Statins, as I said before, all the cholesterol, LDL cholesterol, is produced by the liver. In the liver, there are thousands of factories producing this one. Statin goes into the liver and stops. There's an enzyme called HMG coenzyme A. That enzyme is blocked by statins. Therefore, the production of the cholesterol is halted. So you don't halt everything, but let's say for the 10 production line, 3 or 4 will be stopped. Therefore, the cholesterol level will come down. Since this drug goes into the liver and does the work, it can produce collateral damage to the liver. Therefore, the liver enzymes, ALT, AST specifically, can go up. So almost always before starting statins, we do a liver function test as a baseline. And every time we check cholesterol every 2 to 3 months, we check LFTs, liver function test. If they become very abnormal, 2 to 2.5 times more than the normal, then we will withdraw the statins.
Okay, thank you, doctor. The next question is heart attack and gastritis both cause chest pain. So often people confuse the two whenever they register some kind of pain in the chest. How can we differentiate to action?
It's a tough question because most of the people, as I showed in the picture before, epigastric pain you can get exactly like a indigestion pain. So that one is, as we said earlier, the pain which is coming epigastric region can come during exercise, can during going upstairs. All the exertional part also can produce epigastric pain that is more or less related to this to the heart. But sometimes you can get epigastric pain without even exertion. Even just standing there, you can get after a meal or everything, you can get everything. That means it'll be very, very difficult to think. If the pain is persistent, then you need to make sure it is not the heart. It's very difficult to. A lot of people go for OGD and everything and then come to the heart. So even experts cannot diagnose. But the most important is the history. When does it come? Every time you walk around, you get epigastric pain. You walk upstairs, you get epigastric pain. All this exertional epigastric pain is almost certainly the heart. But if I take some spicy food, I get pain, then that may not be the, maybe usually the things. But if you have risk factors, let's say you have several risk factors, diabetes, hypertension, hyperlipidemia, all these risk factors, and if you get epigastric pain, then you have to definitely exclude your heart by doing treadmill tests or CT angio, some baseline ECGs, all should be done.
Okay. Thank you, doctor. The next question is family history. I think this question even I have. Heredity is one of the primary ways of getting CVD. Is it true, doctor? If yes, how?
Sorry, I didn't get it. Family history, how to avoid, is it? Or?
No, is it like getting a CVD is a family history, heredity history one of the key factor?
Yes, as we said before, family history of heart disease happens familial. Even if you look at other conditions like hypertension, they have familial hypertension, family have diabetes, father, mother diabetes, children also diabetes. So in heart disease, if your parents, father or mother, within a younger age, so for example, your father in their 40s had a heart attack, or your all chest pain, or they put a stent or do a bypass for your father around 40s, your mother before she became menopausal, then it is a family history. In that case, you have to go, even if you don't have any symptoms, you have to go and check yourself to make sure that you don't have any narrowing or blockages.
Okay. Thank you, doctor.
It's done by CT and Joe, easy to do that.
Thank you, doctor. Any other question from anyone? Or if you have any challenge to put it in this link, you can just put in the chat box. Anything from Anand, Tam?
Yeah. Okay. Tam,
Yeah,
please go ahead.
Tam, please go ahead.
Yeah. So, Doctor, thanks for this insightful information on this heart attack. The one question, continuing on the question from Mr. Vengat, you said the person who has some issues in terms of the heart muscles, you should check before going for that, and that could be the case for sudden death in the gym or elsewhere when doing exhaustion and all this. So this health checkup we do they check this as part of the health check? Like how do we go and check it up, say we don't have such issues and we can comfortably go and do exercise, the gym and all that?
So there is a long time back, when I was in Changi Hospital, there are a lot of deaths from NS people who are going there and collapsing. So we asked the Ministry of Defense along with the MOH to see if we can screen all the NS boys using echocardiogram, but somehow it didn't materialize. So that's one. So people who are going to do vigorous exercise, for example, going to compete in a marathon or going around heavy, they're going to do 70 kilometers, 100 kilometers in a cycle. All these people, I would suggest to have them a baseline ECG and an echocardiogram. Because ECG also can give a clue to abnormal rhythm which may come in future. So only if you look at all the Premier League football players, they are subjected to all of these things before they are signed to any of these clubs, because they cannot have collapsing on the ground. So it's a very important thing that I think one of the French guy, I think one of the players many years back collapsed. So that's so in order to avoid, as you say, damn, you cannot be doing to everybody. So you can suspect people who are going to venture on a very going hiking in the baseline Himalayas, going on cycling 70 kilometers around Singapore, people going to take part in Standard Chartered marathon. They all, I have a few people from marathon runners from Singapore come to me for echo and ECG before they go. So that's one way of finding out. But you cannot screen all the youth in the country. Very difficult, unless they have a family history of sudden death.
Okay, thank you, doctor.
Any other questions anybody want to ask?
Yeah, can I ask one question?
Yes, yes,
Muthu? Dr. Jayaram, thank you. It was a very insightful talk, very interactive, and really appreciate all the information you gave. But maybe you have actually given that information, but I don't know exactly how to grasp it. But many times, what happens in general, you feel a little bit of pain here. You know, it's more like gastric. It may be gastric. We don't know. So we keep doing this. Right. And at that time, because of my anxiety nature, I always worry, am I getting a heart attack? But there is no pain. There is no pain radiating through the arm or nothing in the jaw. But still that anxiety is there. That's something, you know, if it comes regularly, then you keep worrying that maybe there is a heart disease. So I go for regular checkup. There is no major issue, but I take medication for cholesterol, BP, everything. So what would you advise for somebody like me, sir? Yeah.
Two things I was taught when I was in the UK. When a person points to the chest, I'm getting pain here. When he puts a finger there, that means it's not the heart. That's sure they can be. So if I'm getting pain here all the time, that's one thing. So you usually it's a dull ache. The other thing is if you're getting frequent that type of pain, which lasts only for a few seconds, sharp pain you can get and then disappears, it is not the heart. Then if it comes only on exertion, then maybe the heart. Without doing anything, if you tell me I can go walking for 2 kilometers, I don't get. I can cycle, I don't get. But when I'm sitting in the office, I'm getting, means not the heart. So you can be reassured.
Very clear, sir. Yeah. So absolutely what you described is what is happening. So it comes for a few seconds,
Yes.
disappears, and I can walk 5-6 kilometers. I used to do brisk walking.
A
So
healthy
far,
man, don't worry.
so far, no problem, sir. Yeah.
Yeah,
Thank you. Thank you, Muthu, for the
Thank you.
question.
Thank you.
Thank you, Anand. Any other questions? Anything in the chat if you couldn't type it in the link? Let me give a minute. Thank you, Doctor. Meanwhile, can you just stop the share so that I can just look all in the picture? I think still it's getting shared. If you could probably stop. Yeah, that would be great. Yeah, that's great. Yeah. Any questions from anyone? Awesome. Great. So let me move on. Okay. Thank you for your thoughtful questions and for being so engaged with the session audiences.
Thank you very much.
Yeah, thank you, Doctor. In the interest of time, we wouldn't be able to accept more questions. Thank you very much for all your questions. I hope today's session has shed some light on how we can take better care of our hearts. Whether it's through healthy eating, regular exercise, managing stress. Remember, as Doctor mentioned, prevention is key. Small steps can lead to big changes. Let's walk more inspired by this talk. And to deliver the vote of thanks, I invite Mr. Tom Shanmugam, an organizing chair and a member of management committee, to the stage. Welcome, Tom.
Yeah, thank you, Muthu. Thanks, Doctor. When I approached Doctor to give this medical talk without any second thought, he immediately agreed, and it was supposed to be somewhere in September, and then we couldn't get time within GOPIO and other members and clash of other events. We have to postpone this to November. So the doctor is the most sought after, and as a cardiologist is always busy, and doctor is also doing a lot of community activities. It's great that he could spare some time for us to come and deliver this talk, which was very insightful, very useful in terms of understanding whether your heart is healthy or how do we exactly go about it to have a healthy heart and all this. So thank you, Doctor, for your time. Thanks for the speech.
Thank you. Thank you.
Again, I also thank our president, Mr. Hari Krishnan, who couldn't be here because of his travel itinerary. So this is his brainchild, his initiative to have this medical series, the talk series, and we have successfully completed more than 8 or so in the last 2 to 3 years. So we had many talks like this, and we had various doctors from the industry in Singapore able to deliver this talk. So thank you, President, for that. He's not around today. And thanks, Mr. Akbar Ali, who's the Vice President of GOPIO. He's accepted to give this welcome speech. And thank you, Mr. Akbar Ali, for your welcome speech. And I also like to thank a few others, Padu, who has actually designed this flyer, Anand, who helped us in getting this link enabled and get all the setup done. And last not the least, the MC of this session, right, Mr. Muthu Kumar, who is very vocal and very energetic today to conduct this session. Thank you, Muthu, for your being the MC of this evening. Thank you for that. And last not the least, I would also like to thank all the participants who had come on a Sunday evening to join the session and to get this useful information and insightful information from the doctor. Thank you, everyone, for being here. Thank you.
Thank you. Thank you. Thank you.
Thank you, Mr. Tom. Well, all good things must come to an end for a day, but don't worry, we'll be resuming more medical sessions in future, medical talk session in future. As we draw close to the end of this insightful seminar, we express our gratitude to the speaker, Dr. Jayaram Lingamanaicker, and to our esteemed audience for your active participation, and GOPIO especially for making this seminar a vibrant pool of knowledge exchange. On behalf of the entire team, thank you once again for being here. Take care, stay healthy, have a wonderful evening. This event wouldn't have been possible without the tireless efforts of organizing team and several other individuals. GOPIO Singapore would continue to conduct similar events on a regular basis, so please be on the lookout for our next health series event. I thank the organizing committee to have entrusted this opportunity to conduct this session as your MC. Thank you very much for joining your session. See you back again. Signing off, Muthukumar. Thank you and goodbye. Happy hearts and happy minds. Thank you.
Thank you, Doctor. Thank you.
you.
Thank
Thank
you.
you.
Thank you.
Thank you very much.
Thank
Thank you
you.
very much.
Okay, thank you, sir. All.
Thank you.
Thank
Thank
you,
you.
Dr. Jayaram. Romba thanks.
Thanks.
Wonderful, very informative session, sir. Thank you. Yeah, a lot of the questions, we don't need a question answer session. You anticipated everything.
Yeah.
Correct.
Yeah,
In fact, I was
absolutely.
just searching what to ask because you have mentioned everything.
Absolutely, sir. Romba thanks, sir. Romba
Oh,
thanks.
thanks.
Yeah, thank you.
Thank you.
Okay, sir. Bye.
I can stop the recording now. No?
Yes, sir. Please.
Oh, sorry, I didn't take photo.